It's 2 o'clock, so we'll get started. Thank you all for joining us this afternoon. I know it's a busy afternoon of press briefings. Today, we will hear from Milwaukee County Executive David Crowley. Next, we'll hear from Mayor Tom Barrett. Then we have Dr. Ben Weston, Director of Medical Services for the Office of Emergency Management. We have Dr. Jeanette Kowalik, Commissioner of the City of Milwaukee Health Department. Chief Judge Trigiano with Milwaukee County Courts. And we're pleased to be joined by Jennifer Camerood, who is a Senior Policy Advisor with the Wisconsin Department of Public Instruction. Thank you all for being here with us today. And County Executive Crowley, we'll start with you.
Thank you so much, Catherine. Good afternoon to everybody. I first want to start off things to remind people about testing. I want to let folks know that testing is going to be a critical part for us all to make sure that we're doing it to mitigate the spread of COVID-19. And while I'm very aware that people are probably tired of hearing about us talking about testing, but we cannot emphasize it enough. It's going to be up to all of us to make sure that we're doing everything that we can to keep ourselves, our loved ones, and our neighbors safe. And it's the best way to make sure that we are managing this virus. I also want to remind folks that the National Guard sites at UMOS and Custer Stadium are still open Monday through Thursday, 11 to 7 p.m., and Friday and Saturday from 11 to 5 p.m. These testing sites will be closed July 2nd through the 5th to observe the 4th of July holiday. But I want folks to remember that we still have more than 17 other testing sites available throughout Milwaukee County. So if you need to get tested, please visit Impact 211 website or call 211 to finding a testing site near you. We also today have Chief Judge Trigiano joining us to talk about the reopening of the courts. And so we'll begin holding in-person trials on July 20th, and people will start to receive their jury summing letters as early as next week. We are working closely with health consultants to redesign our courtrooms to make sure that we're adhering to the CDC guidelines. So we want to make sure that people can feel comfortable when they enter the courthouse. And I know the judge will provide more details about the precautions that we're taking, but I want to emphasize the importance of reopening our courts. It's extremely important that we open our courts to make sure that we're protecting people's rights to a speedy trial. It's their constitutional right to receive a fair and speedy trial, and some of these trials have been delayed because of COVID. And so, if we want to fight, we're going to continue to fight to address the root causes of racial inequities. And the key area of this is focusing on criminal justice reform. And when you think about our criminal justice system, we know that it's directly impacted many people of color. And because of COVID-19, many of their cases have been postponed. So holding them in this system longer than needed is not doing us any justice. We owe it to these individuals, and so we're doing everything that we can to reopen our courts right now. So just like anybody else, we're still fighting COVID-19, and I know that as we talk about our courts, many people may be cautious of really coming into the courthouse and attending their jury duty. We want to assure folks that our reopening protocol is literally being led by health consultants. And so we want to make sure that what we're doing is rooted in the best practices shared by the CDC, and that's what we're doing. And lastly, I just want to say thank you to the Department of Public Instructions for joining us today. As a father, I totally understand many people's concerns as how we are reopening our schools, and I'm right there with you. These last few months have been a tough time for me and my children, and I have utmost respect for our teachers that have been out there during these unprecedented times to make sure that our children are learning. So I just want to say thank you to all of our teachers and say again, thank you to DPI for their proactive approach and guidelines for different districts and school leaders as they consider how we open up the upcoming school year. And so I believe that's all that I have. And I just want to say thank you for this opportunity as every Tuesday and Thursday brings, and I'll hand it over to Mayor Barrett.
Thank you very much, County Executive. And I'll pick up right where the County Executive left off. Most of my kids are out of school. I still have one child in college right now. So I haven't had the pleasure that he has had over the last few months. Although my wife is a teacher, and I will say that I think that she has gotten more appreciation from parents over the last couple months than she ever did before. Because all of a sudden parents realize, well, maybe it isn't as easy as it appears to have your kids with you 8 hours a day. So I think it's a learning experience for all of us. I also want to echo the comments that he made about testing. And I know that everybody is tired of all of this. And everybody wants to treat this as though it's gone, as though it's old news, as if let's just get back to life as normal. But I think we all recognize, or we should recognize, that there are storm clouds here that we have to be mindful of. I thought it was very telling, for example, that the European Union is talking about having a ban on American visitors to Europe this summer because of their belief that we have not gotten COVID-19 under control in the United States. That's something I never thought I would see in my life, that other countries are looking at us as an area where we have not dealt with a serious issue. But that's what we're looking at right now. I also want to point out, because I know there's a lot of people who have been involved in protests and marches over the last 3 weeks, that South Carolina, I think it was South Carolina, saw a number of individuals who were involved in the protests testing positive. If you were in the protests, if you were in the marches, if you were exercising your First Amendment rights over the racial injustices that we have in our nation, you should still get tested if you are showing symptoms. You've been with a lot of people. There have been a lot of people outside over the last 3 weeks in close proximity to each other. And we do not want to see an increase in the number of people who are infected with this disease. So please, as the county executive went through the different places where you can be tested, please take advantage of them. Please call 211 if that's necessary. Go to one of our community testing sites. But if you're showing any of these symptoms, please make sure that you are getting tested. I also want to raise the points that Dr. Raymond raised earlier today, and I know Dr. Weston is going to talk about some trends, but we had a run of about 16 days where the numbers were really quite positive here in Milwaukee and throughout the state of Wisconsin. And that was happening at a time where we were seeing more and more states that were seeing their numbers go in the wrong direction. And as Dr. Raymond said earlier today, it was somewhat perplexing as to why our numbers were going in the right direction when we saw so many states whose numbers were not really trending in the right direction. And unfortunately, it appears that that's beginning to catch up to us because now we, along with 23 other states, are seeing unfavorable trends in terms of what we're finding with the testing of individuals. One of the factors that's looked at quite often is the reproductive rate. And when the reproductive rate is below 1, that's a good sign. And for much of the last month, our reproductive rate here in Milwaukee was less than 1. Unfortunately, it is now greater than 1, which means that it is becoming more contagious and it is spreading. Our number is now actually higher than the state number. Our number, according to Dr. Raymond's, is 1.12, whereas statewide it's 1.09. And so that is not a good number. That is not a good number, but another powerful message as to why people should continue to do their social distancing, why it's important to wear masks. This is not a political debate. This is a healthcare debate. This is a healthcare practice, more specifically. And if you're going to be interacting with other people for your own benefit, and probably as much, if not more, for the benefit of others, please make sure you're wearing those masks when you're out in public. We are continuing here at the city to do everything we can for educational purposes and building off the success we have had with our webinars over the last several weeks. I'm pleased to announce that we will have another webinar tomorrow night at 6 o'clock, and you can sign up for this tomorrow. This is one for child care providers. It'll be at 6 o'clock on Thursday night. 6 o'clock on Thursday is when you'll be able to join us for a webinar for child care providers. And then Friday morning at 9 a.m., we'll have another webinar for faith leaders because we're obviously, as we've moved to stage 3, we will be seeing more people in the churches. The commissioner will talk about some of the analysis that we're doing as we look at what happens next. But again, my message is, as it has been now for 3 months, is that this is still a very serious matter. And as much as we want this to be gone, it's still here, so we continue to have work to do. So with that, I believe I turned over to Dr. Weston, but thank you all for joining us once again today. Dr. Weston.
All right, thank you, Mr. Mayor. Good afternoon, everyone. First, as always, to our numbers. I'm going to pull up our dashboard today. So we see that we have 10,438 cases of COVID-19 in Milwaukee County and 339 individuals who have died. We do have a couple things on our dashboard that I just want to highlight because they are newer features. So I won't go over everything we've talked about before, but a few newer features. So we do have now relatively new a 14-day map just to see what are presumed active cases, but new cases within the last 14 days. We also have a 7-day map where you can see just new cases over the last 7 days. And then the newest addition is a testing map. And so this shows the concentration of testing. You can see it ranges from the orange is the lowest rates of testing per citizen per capita, up to the dark purple, which are the highest rates of testing, as high as nearly 3,000, or actually it goes well over that. I think it goes over 4,000 tests per 100,000 residents. So purple, high testing rates, orange, low testing rates. And then in this same tab, you can change the layers to see the percent positive. And so these are the percent of tests resulting positive. So on low ends, you have 0. And then on high ends, you get up to, say, 40% in certain census tracts, certain communities. So these are two new visuals that I think should be helpful. One other thing to point to is just a benchmark. We have over 100,000 tests now in Milwaukee County. 103,052 tests have been performed, to be specific. As mentioned, we have over the last few weeks seen good progress on our numbers overall with respect especially to percent positive rate and our COVID-19 hospitalizations. There does appear on the dashboard to be an increase over the last few days in the percent positives. I am told there's some data that should be pushed through to the state database tomorrow, and hopefully that'll give some more clarity there. So while this appears to be a movement in the right direction, we must be vigilant that COVID-19 is still with us. And as with past pandemics, it's likely that a resurgence of disease will eventually come. So that's why it remains as important as ever to be cautious and consider people, space, and time. So again, the number of people you interact with, the space with which you interact and the utility of masks in that space, and the time that you're in close proximity. People, space, and time. Yesterday, as discussed, the Wisconsin Department of Public Instruction, the DPI, released Education Forward. So this is a summary on how to safely reopen Wisconsin schools. It's a detailed document that lays out multiple options from which schools may model their planning as they prepare for education in the fall. Importantly, it includes considerations on immunizations, screening, messaging, and mental health as well. It provides several educational models, including learning in virtual environments, different rotation schedules, flipped classrooms, and various combinations of each of those. Overall, it takes into account, I think, the critical aspects of physical distancing, including people, space, and time, as we discussed before. So without a doubt, school will look different in the fall, and necessarily so. Strategies such as cohorting of students into smaller groups, rotating in person with virtual learning, and modifying the physical environment to promote safety will become a new normal in our children's lives. And I think if done right, it'll certainly benefit them from a health perspective, but also educationally. As schools consider and prepare for the implementation of these guidelines, it's important to plan for and expect a worsening pandemic in the future, rather than relying on your individual community's perceived disease burden from the past. If we've learned anything from the first few months of the pandemic, it's that no community is immune. What initially may have seemed like a Milwaukee problem in our state has become widespread. It's affecting communities on all ends of the socioeconomic, political, and cultural spectrums. That's to say, even if you believe that cases have been low in your community, it is better to plan for the pandemic than to be taken by surprise in the fall without adequate contingencies in place. Lastly, though the DPI guidelines are thorough and detailed, it's up to each community and their decision makers to work to provide funding and support in an equitable manner to ensure that lower resource schools are able to implement the highest level of safety standards to the exact same degree as higher resource schools. We must work to ensure that the schools and communities that are far too often left behind are at the forefront of consideration of safety and health moving forward. Thank you and stay safe, and I will pass it along to Commissioner Kowalik.
Thanks, Dr. Weston. Good afternoon, everyone. So as Dr. Weston noted, the need to focus on people, space, and time as considerations for preventing exposure to COVID-19 in our community. So Milwaukee City and County now has the highest rate of COVID-19 cases in the state. So if you're looking at the rate per 100,000, it's 1406 as of yesterday, and 1098 respectively. Not the county, but the state is 426 per 100,000. So you can see the variance there. Again, this is cumulative, so we're looking at all cases from the beginning of our outbreak, which was on March 13th. Knowing this means that we still have to be vigilant, that we can't just wish it away and assume that COVID's not a big deal. Again, noting that COVID-19 infection is an unknown. Yes, there's people that recover from it, but we don't know necessarily how that impacts them for the rest of their lives. We did see that increase among adolescents in the Hispanic or Latinx population. So just getting the word out that young people are at risk for exposure and illness related to COVID-19. We also know that young people can still expose people that may have a hard time fighting it. Their immune systems may be compromised, such as myself, or people that are over the age of 65. So again, just not thinking of yourself, but thinking of others as we move into this new normal, living with COVID. Another thing too that I wanted to talk about was, or not was, but is related to the City of Milwaukee's orders and moving Milwaukee forward safely. So you know that we're coming up on an evaluation goalpost this coming Friday. So we'll see where we're at. We can't make any commitments at this point in time that we would advance into phase 4. But what we're looking at in the meantime is looking at restaurants only, not bars, just restaurants, and creating some type of pilot to where the health department is evaluating mitigation plans and then giving them a seal of approval so that restaurants can open up at 100% capacity, granted that they're implementing the plans, the approved plans that they have in place. So this will begin on Friday, and then it will take effect the following Friday, so right before the 4th of July holiday weekend. So we wanted to make sure we're listening and looking at some concerns from the community related to risk and being able to brace for some of the concerns related to COVID-19 infection that are associated with being less than 6 feet from another person. And we're still going with the 10 minutes. I know the CDC updated theirs to 15, but because we have the highest burden of disease and fatality in our community, having the 10 minutes is totally appropriate in my professional opinion. You know, again, we'll see where we're at with moving Milwaukee forward safely this coming Friday. If we're moving in phase 4, that means that more sectors will have the ability to open up a little bit more broadly. We're still being mindful of the need for people to wear masks or mouth coverings, covering nose and mouth, just not your mouth. And then also the enhanced hygiene practices that need to be in place, not just washing your hands, but also making sure you're disinfecting and cleaning high-touch surfaces such as doorknobs and elevator buttons and handles and things like that. So again, we still need to be vigilant. COVID-19 is still in our environment. We definitely don't want to encounter another surge, looking at other places in the country and what they're grappling with because they just let loose too soon, to be quite honest. And we're just being very mindful of how we're going to move forward safely, which is what this is all about. Again, that restaurant aspect, you may wonder if, okay, you're looking at the last 4 days and some concerns from other healthcare leaders in our community. But again, we're looking at 14 days as the point of concern. So 14 consecutive days, and we're using logistic regression to determine if there's statistical significance and whether the trend is accurate or not. So that's what we're doing at the City of Milwaukee. And then also being mindful of access to resources. So testing is extremely important if you're protesting or demonstrating, making sure that you're getting tested, that you are able to do so and not be retaliated against for exercising your freedom of speech. But also for people that are essential workers, that you are also getting tested, because by the way that you're going to work, if you're not using your own vehicle and you're the only person in the car, but just if you're using public transportation. And then also just being in work settings where there is more congestion, if the employer doesn't have it set up to mitigate the risk as best as possible that you may be exposed, so that you should be getting tested on a regular basis. Again, this isn't just a one-shot deal. Testing is something that should occur over time depending on your level of exposure or presumed risk. So again, just be mindful, enjoy the warm weather, but please do so in a safe manner. Thanks.
Thank you, Commissioner Kowalik. And now we'll hear from Chief Judge Trigiano.
All right, good afternoon, everyone. First, I want to express my gratitude to County Exec David Crowley and the county team, as well as John Barrett from the Clerk of Courts and other stakeholders, for really putting a lot of hard work into bringing the courts up. Everyone has been incredibly helpful and working hard to bring us up safely, and with all of the public health safety precautions in mind. I have three things that I want to emphasize here today. The first is I think the most exciting thing, which is we are working and preparing hard to reopen some courts, but at least 2 jury trial courtrooms by July 20th, Monday, July 20th. As I mentioned before, we're working very hard with public health consultants that have been provided by the county to redesign 2 courtrooms for those jury rooms, jury trials, to ensure that we are adhering to CDC and other public health mandates and guidelines to keep everyone safe in this courthouse complex. So we are taking a variety of precautions and working hard to put them in place. Those include mandating the wearing of masks in the courthouse complexes here and at Val Phillips Family and Justice Center, and providing masks for those that don't have them. We are looking at protocols to ask individuals to answer CDC health questions so that they're aware of the safety precautions we're taking in place for their health as well. We are redesigning 2 courtrooms and a jury meeting room, or assembly room as we call them, to meet the 6-foot physical distancing between individuals goals that we have for people who come into the courthouse, and installing plexiglass where necessary and where 6-foot distancing might not be able to happen right away. The cleaning of the courthouses and the courtrooms is beginning and will continue on, and there'll be a increased cleaning protocol. Hand sanitizer will be available, and again, plexiglass in high touch areas, so people are being social distanced if they can't do the 6-foot. There are also now signs in the courthouses. The elevators will only allow 2 people in, so I've had my tennis shoes on trying to run up and down the stairs so that we're not crowding the elevators to try to get up to the different floors, but those will also have protocols in place for social distancing. So we are looking at people, space, and time and trying to follow suit, and having our public health consultants double check all the work that we're doing to make our courthouse safe. The second message that I'd like to get across here today is that it really is imperative that we reopen the courts to protect individuals' rights to their speedy trials. And so the jury trials that we're opening up are really, really important right now. We have approximately 200 speedy trials pending. Those are for individuals who have been waiting in custody to have their day in court since the pandemic began. Families have been disrupted, and there's no closure for people who are waiting their trials and those that were involved in the situation. So it's really important that these 2 jury trials and then more are opened as quickly but as safely as possible. We will be hearing criminal cases first, even though we have some civil trials pending. We will look at the oldest to the newest and try to triage those cases so that we can get through them as quick as possible, but again, as safely as possible. We don't want people having to linger longer in the system than they have already been. I would also say that the courts certainly bear responsibility for creating a more racially equitable system. And as County Exec Crowley said, many individuals currently in our justice system awaiting trial are people of color. And that's why it's absolutely imperative that individuals have their cases presented to a jury of their peers, and that we have very diverse jury participation that is representative of the Milwaukee County residents. We understand completely that not everyone is going to be able to participate in jury duty. They may have compromised health situations, unable to travel, have other challenges, but it's really important that every able-bodied citizen help us provide individuals their rights to a fair jury trial. And so again, we are working day and night trying to make sure coming to the courthouse is safe, and messaging that out so that it is also inviting for people to come in and help us ensure that equal justice and access to justice. Finally, I would like to say we will continue to share more information regarding court reopening protocols. I will have an order that's going out to the public very shortly for the initial phases of a variety of courts opening, but in particular for jurors coming in that week of the 20th of July. We understand completely that we are still under a pandemic. We've been very watchful of that. We've been very careful, and we've listened intently to our public health consultants because it's just the right thing to do. And so our protocols will be led by health consultations rooted in best practices and CDC guidelines. I know also that John Barrett's opening the Clerk of Court's office for more hours, and will start being available from 10 o'clock in the morning till 3 instead of 12 to 3. That will bring more traffic into the courthouse, but again, following all safety precautions as best we can. With that, I will turn it over to Jennifer Cameron, the Senior Policy Advisor for the Wisconsin Department of Public Instruction.
Well, thank you very much, and thanks for inviting us to this call today. As you know, we released our return to school guidance titled Education Forward yesterday. And I want to just start by saying that that document is a product of months of work with educators and education groups, and work with our state health agency to look at what we learned from last spring, and to look at what procedures we recommend people put in place, and how schools can begin having those conversations locally. One of the key things that we're stressing in this guidance is that you really need to work with your local health agency. So DPI is the education agency. We are not the health agency, which is why we work so closely with the Department of Health Services as we develop this guidance. One of the key pieces of the guidance, and I'm not going to go into all of it because Dr. Weston did a wonderful job summarizing many aspects of it, but one of the key parts of that guidance is a risk assessment checklist that the State Department of Health Services developed. We would like school districts and private schools who look at that guidance and use that guidance to take a look at that checklist, to talk about that checklist with their local health authority, and to then think about what decisions they need to make to provide the safest environment possible in the school. And I want to say the decisions they make. We have received a lot of questions from parents across the state after release of our guidance yesterday, and others wondering why the Department of Public Instruction wasn't more specific about some things or more directive. And I just want to clarify briefly that the department has authority to provide guidance, but ultimately these are all school district decisions at the local level. So school districts, in concert with the local health authority, need to be looking at what risk mitigation steps need to be taken, what's going to work in their space and in their learning environment. And then a school district has to make the decision of how they're going to run the educational operation in the district. Ultimately, we do not have authority at DPI to close a school. The local health authority does, The school district does, the state health agency does. And so questions about, well, what happens if there's a high absence rate, or what happens if the course of the virus changes, those are all decisions that are going to ultimately be made locally. One of the key pieces of our guidance is really that conversation about the different learning scenarios and what school could look like. We are telling districts that you need to plan for multiple scenarios. We expect schools to open in the fall, but we don't know what the course of the virus will be like. So schools should plan for the possibility that they may need to close or may be closed for a period of time. Additionally, there will be students who can't return to school. They may have underlying health conditions, or there may be concerns by parents. And so school districts will also need to consider how they will provide an education to those students who are unable to be in the school setting. These are all difficult questions, and we are encouraging parents to talk with their local school districts about the concerns they have. I do want to note that we have our school nurse consultant, Louise Wilson, on the line as well. And so I would like to ask Louise if she has anything she would like to add to the conversation.
No, I guess again, the primary direction behind and the emphasis for the return to learn, the forward education, is making sure that students are as safe as possible. Again, we're in the midst of a pandemic, so we need to do all the mitigation measures that will help make the environment safest. And then we also want students and staff to feel supported as they return to school. So there are other mental health and other resources in the guidance to kind of support students, staff, and families as they return to school, because we do know that it has been traumatic since the spring, and it's been traumatic over the summer, and returning to school will also create a lot of change and anxiety for people. So again, it's safe and supported is really what the message is.
Well, thank you both for joining us. We're going to move to the Q&A portion of the briefing, and I do have a few questions in the queue. The first one is from Mark McPherson with CBS 58, and it's for Commissioner Kowalik and the mayor. He asks, as COVID-19 restrictions are lifted, states are seeing another surge of cases. Is it reasonable to believe that we will have restrictions in place until we have a COVID-19 vaccine, potentially 6 to 12 months from now?
Well, obviously it seems like the vaccine is the goal. That's going to be the thing that will make all of this go away. But we need to be cautious about that. For one, granted, when HIV first came on the scene, there was all this talk of there's going to be a vaccine for AIDS or HIV. Where is it? We're still waiting now. So, we need to be mindful of vaccine development, that it can take some time. We do know that there are some ways to prevent the spread of COVID-19 by some of the things we can do, like the people, space, and time, elements. We're learning more about COVID-19 and, even like how long it lasts, like how long it stays in the air, there's different things we can do to limit the spread, but really getting tested, knowing your status, knowing that there's people that are asymptomatic, maybe carriers, maybe spreading the virus. We also know in other communities, there's this concept of super spreaders, people that are very infectious. So how do we get a hold of these folks and try to track down and box in COVID-19 infection for anybody that's been exposed to those people? So there's some methods that we can do to really help us kind of contain this virus and move into a new normal. I'm not going to say get back to normal because that's out of the window now, but waiting on a vaccine, I think we need to just be cautious of that may be something that may be far out of reach for us. So we have to just take additional precautions. The testing technology is going to continue to get better. And I'm talking about testing, meaning just the standard PCR and throat swab tests. Also the antibody testing get better. So there's some things that will improve over time that will help us be more nimble in our response. But of course, making sure that there's adequate funding for public health. We know that there's been this trend of attacking public health officials, whether it be threats of violence or, undermining our authority or all other things that are going on. So many of our professional associations are standing up and sticking up for us, basically saying, we're the public health authorities, we're trained in this work. We need to have confidence and be able to be heard that what we're saying is for the greater good and that we don't have a political agenda or anything like that. So, I just want to put those things out there, that those are threats to our ability to move into this new normal. If you don't trust the person, or you're undermining or eroding the trust of the person delivering the message. So thank you.
I just want to echo what the commissioner said, and her first statement was what was going through my mind when you asked the question. And that is, of course, we would love to have a vaccine tomorrow or the next day or a month from now. But the reality is we can't say with certainty when it's going to be here. Just as she evoked AIDS and what happened through the evolution of AIDS, that's what I was thinking as well. I think when AIDS first hit in the 1990s, the belief was, well, we'll get a vaccine, and that will take care of it. But here we are now 26, 27, 28 years later, and adjustments have been made. People have learned how to deal with it. It still is a very serious disease. But 3 months ago, I don't think anybody could have predicted where we are right now. And I can't even predict with certainty where we're going to be 3 months from now. So I think that's why it's so important to follow the science, to continue to look for ways for us to adjust our personal behavior and our societal behavior until and unless we do get a vaccination. So I think the biggest thing, again, is to try to find out more about the disease, try to find out ways to treat the disease, and make sure that we can catch people. And that's why the testing is so important. That's why the tracing is so important. That's why the isolation is so important. That's why the social distancing and the masks are so important.
And thanks, Mayor. I also want to touch on that, talking about isolation and quarantine. So we are issuing more orders, as you can imagine, due to the nature of the situation. And the Milwaukee Police Department has been a solid partner in helping to execute orders. So we just want to put it out there for the public. Again, we know that finding out you're infected with COVID-19 isn't necessarily, it's something that needs to be considered as serious. And you may think, oh, I'm just going to be sick for 2 weeks and I'll blow it off. No, one, we don't know how this virus is going to impact you long-term. Two, the impact on other people. And we know that it's difficult for some people in our community to isolate and quarantine because of limited resources, not having money to be able to pay living expenses, or having a place to isolate or quarantine. So just, again, reaching out to us through 211, where we have a variety of resources where we can connect you if you have some limitations or concerns about being able to do so. But on the flip side, for people that are just like, oh, this isn't a real thing, I'm just going to keep living my life. That's where we take a different approach. So we don't want to be able to get involved heavy-handed legally, but we will if we have to, because it's about protecting the public. So, we'll continue to kind of pull that data together to show how many orders we've issued, but we have been issuing more lately. And lastly, I want to point to that the Attorney General pointed out about scammers reaching out to people, posing as contact tracers or the health department. And, again, don't give out any PHI, don't give out, your social, any banking information or anything like that. I mean, the health department, we need money, but we're not going to do that. We're not going to ask you for your social security number or banking information. So please do not do that. When we call the city of Milwaukee, it's going to come up as a 414-286 number. If you're getting, say you went to these community testing sites, UMOS or Custer or Barack Obama High School, you're most likely going to get a call from a 608 number, Exact Sciences, if they're reaching out to you through their people. But more often than not, it'll come from the city health department. So they'll be handled by the health department where you reside. But again, 286 is a city number. And I think the county is 278 or something like that. So, just knowing what numbers are calling, you see that number pop up, knowing that those are legit numbers and that it's not a scammer. Thanks.
Thank you for that helpful reminder. Our next question is from Derek Rose with WISN 12, and it's for Commissioner Kowalik and Dr. Weston. He asks, would you consider COVID-19 testing a double-edged sword as referenced by the president over the weekend? How does increased testing help or hurt Milwaukee County?
Well, I can start that off. I think all of us were horrified by that comment that he was intentionally slowing testing down. And we know that's been a big concern from our community. Like, you know, early on, people were like, I want to get tested. I want to know if I have this. I want to know if I'm at risk. And we had these limitations because we didn't have enough testing kits. Now that we have more access to testing kits, to hear that there's an intention to limit access is extremely horrifying. Like, we want to make sure people have access to services. So at the local level, we're pretty much, our abilities are limited because everything kind of trickles down from the federal to the state to the local. So, you know, we're spinning our wheels here trying to help and really protect our community from COVID-19. So we need everything that we can get. So, you know, it is very discouraging, but having more testing, we know that folks may get tested one day. That doesn't mean that they're safe. You know, that depending on their level of engagement, say if they're essential workers or they were demonstrating or protesting or anything where they're around people that are outside of their household, they might be at risk for COVID, so they should get tested on a regular basis. So I know there's some concerns statistically when you over test, how that impacts samples, but Dr. Weston can touch on that as well as any other related topics.
Yeah, and I would just agree. I think any you know, effort to slow down or hold back testing at all, whether locally or nationally, would be very a huge setback for everything that public health departments are trying to do. Only with testing can we know who's positive, who to isolate, who can work, who shouldn't work. It doesn't just affect communities; it affects individuals, and so. To pretty much every extent with the current testing limitations, we have more testing now, smart testing, strategic testing, but more testing is going to benefit us as a community.
Thank you both. We're down to the last question that I see in the queue, and it's from Sharon Bajenda with CBS 58, and it's for Commissioner Kowalik. She's hoping that you could talk more about the program that would allow certain restaurants to apply and get permission to have full capacity. The governor has said that restaurants would have to submit their coronavirus plan. Also, is there a lack of people wearing masks as places begin to reopen? And is that concerning?
Oh, absolutely. So, you know, you see some folks that are on it with the masks, they're wearing them properly. You see some other people that are, you know, throwing that by the wayside. We know that at this point in time, wearing masks can provide some protection. So one, if you happen to have the virus from spreading it to other people, but just, you know, if you're in a space where it's airborne or anything like that. So we want to continue to encourage our community to wear masks, to make it a norm that you're wearing a mask. Obviously, there's people that might have some health situations where wearing a mask might be problematic. We also know for our deaf community, being able to sign and see people's mouths, we see that there's masks now where it's clear, so you could see the mouth movements. So knowing that there's some you know, concerns there, but there's some workarounds that we can use. For the rest of the community, wearing a mask should be something that we embrace. We were very hesitant about making that an ordinance or including it in an order earlier on because there was a limitation for access to masks and PPE. So we didn't want to create something that, one, people didn't have access to, and two, that would create a disparity between the haves and the have-nots, people that have the money to be able to stock up and wear masks versus people that don't. And we also know the cultural aspects of people wearing bandanas, people of color, Black people, Latinx people, like sometimes there's perceptions that they're not up to any good or anything like that, which is totally false. So we have to shift and destroy that type of stereotype that if someone is covering their mouth, their nose and mouth, you know, to the chin, that this should be seen as a courtesy, a way of them protecting themselves and others from COVID-19. So again, we have to shift the mentality of mask wearing. And then the question about the plans is, I put this in a chat box, but what the health department is doing through our consumer environmental health section is, one, it's very hard to just say, you got to come up with a plan. We know some businesses, they have, the ability to develop plans. They have the resources, they can put it together. We know other businesses may have that may be a challenge for them. So we're working on developing instructions how to do this. So a template, and then also an example of a complete mitigation plan. So you can see what it looks like, because we know everybody learns differently. And then also creating an opportunity to educate or answer questions from the public related to this restaurant opening aspect of our COVID-19 response. So then once your mitigation plan is complete, you would send it to the health department. The email address is listed here in the chat, but for the viewers, it's CEHadmin, so ADMIN @milwaukee.gov. Make sure that in the subject line, you're putting the name of your restaurant and that you're also saying COVID-19 risk plan, so we know what it is. We receive a lot of things in that email, including complaints for violations. So we want to make sure we're prioritizing those plans so we can start reviewing them. And our health department staff in the CEH section are amazing. They've been trained by the CDC on how to do this. When the CDC was here in May, walk through how to do these plans, as well as look at employer-based infections and EPI. So we're very confident we can turn these around, but obviously we can't give it to you like instantly. Like there's going to be a little lag in getting it back, because we want to make sure it's on point and that you actually have some constructive feedback into how to make your plan more robust and realistic. So I would say 7 days, 7 business days tops in getting your plan back. So that email address is listed again, CEHadmin @milwaukee.gov, and then we'll move forward on that front. But I also want to know, for some businesses, obviously we still have COVID in our environment, we have community spread. They may not feel, or the business owners may not feel comfortable opening up like this just yet. So they may want to wait till phase 4 or phase 5 to open up to where there's more capacity afforded due to that phase. So that's totally fine too. So don't feel like now everyone has to come up with a plan. It depends on your circumstance. So again, we're giving people an option, just like with the active streets opportunity. This is also a pilot opportunity, because we still have to move into this new normal.
Great. We have another question for Chief Judge Trigiano, and it comes from Casey Cronus with Fox 6. She asks, when jury trials resume, has it been discussed yet whether witnesses, defendants, and the jury will be wearing masks during trials? Will it be required, or will it be their choice?
So thank you for that question. That's been asked a lot, so I appreciate being able to answer it here. Masks in the courtrooms are mandatory for everyone, including the judge, witnesses, jurors. It's not only a county policy for courthouses, but it is a mandate from the Supreme Court at this time. A judge in a courtroom, however, can make a decision, a reasoned decision, on being able to have someone remove a mask, mostly related to people being able to see a witness's face for facial expressions and credibility purposes, and use that discretion wisely in certain circumstances. That's one of the reasons why we asked the county and are working with the county and the public health folks to put up plexiglass near the witness stand and in between individuals at counsel table in case a mask needs to be removed for a short period of time. But again, masks in the courtrooms and in the courthouse are mandatory.
Thank you. The final question I'm seeing is from Mary Spicuzza with the Milwaukee Journal-Sentinel, and it's directed at anyone who's able to answer. She asks, during his visit to Wisconsin, Vice President Pence said the coronavirus that every day is one day closer to putting it in the past. Are you concerned that his comments are overly optimistic?
I can start here. I mean, I think that technically every day that passes, we're one day closer to everything that happens in the future. However, I think the end of COVID-19 is still a ways off. We've talked a lot about that, whether it's a vaccine that hopefully brings it to an end. Although, to be honest, with a vaccine, we have to think about how many doses it takes, how effective is it, how much immunity does it really provide, how is it administered, how do we distribute it equitably. There's a lot of issues rather than just, the first step is developing a vaccine, but there's a lot of steps after that too. But overall, I think we have a long road ahead of us, and I think we would do well to be prepared rather than to be overly optimistic.
I agree.
All right. Well, I believe those are all of the questions I'm seeing. I did receive a few questions about how to register for the webinars that Mayor Barrett referenced, and you can go to the Milwaukee Health Department for more details on how to register for those webinars. So please check that out. And with that, that concludes our briefing. So thank you all to all of our guests who joined today and shared important updates. Thank you to our principals who joined us, and we'll be back on Thursday at 2 p.m.
Thank you all.
Thank
Thanks,
you.
everybody.
Thanks. Bye.